We are still here. It's like a Good Living segment. My name is Asiedua Akomia. I'm seated this morning with the very beautiful Dr. Vanessa Apea. She's the CEO of the Accra London Health Centre. And she's also, there's N, okay? Harvard-trained clinician and advocate for health equity.
Good morning.
How are you?
I'm really well, thank you. How are you?
I'm doing very, very well. So
Good,
today, the topic, the focus of discussion for Good Living segment, COVID-19 resurgence. That's what we are looking at. It's like now at this point, I'm exhausted because I was thinking that, we've moved past COVID-19, since, 2020 where everything had to shut down. Businesses, we had to go on lockdown. You couldn't travel out. You couldn't travel within the country. You couldn't do anything. All you had to do was to just be home. And then just when we thought that things were getting better, it seems that COVID-19 has decided to rear its ugly head again. But the question that when Dr. Vanessa Apea came in that I asked is that, did it ever go away? Did COVID-19 ever go away at some point?
No.
And she just plainly said no. But before we delve deeper into this conversation, we want to go back to the State House, the forecourt of the State House, where the National Thanksgiving, Prayer and Thanksgiving is currently ongoing. And so, KMJ, what do you have for us?
Not unto us, O God, not unto us, unto you be all the glory. The whole nation stands in thanksgiving on behalf of His Excellency the President and all the arms of government, the public sector, private sector, our traditional rulers, religious leaders, every soul in this nation. We bow in thanksgiving.
So officially, the National Day of Prayers and Thanksgiving has started. It's currently happening at the forecourt of the State House. And so we'll be going there so you can have, you can better enjoy all that is happening at the forecourt of the State House. But before that, we have to talk about the resurgence of COVID-19. I have seated with me Dr. Vanessa Apea. Dr. Vanessa, I asked the question, did COVID ever leave? And you said a big fat no.
Exactly.
It never left.
It didn't. And I think that we were in a state many years ago.
Yeah.
2020, it, as you said, reared its ugly head, and we had to deal with something that we didn't understand.
Yeah.
And then we moved across and we had so many things that affected our day-to-day lives, travel, work, etc. And then globally, around 2023, the World Health Organization moved it away from being a public health emergency of concern. So they said that it's still here, but we can live our lives and continue. And so COVID has always been here. It's always been circulating. You'll always have intermittent cases. But what we've recognized now is that we've seen a certain peak in certain groups, and it's just reminded us that it is here and we need to keep surveillance going and we need to keep the awareness going.
What can we do now?
First of all, I think things like this, talking about it, because when we first dealt with COVID, there was so much uncertainty and there wasn't consistent information about it. So it's, again, telling people to be vigilant. It's not cause for alarm. I say it's cause for awareness. So to know that there are still cases out there. So when we've got to think about when we're in public spaces and we're in crowded spaces, do we need to go to massive crowded events? If we've got symptoms, making sure that we've got a mask on and covering our nose and mouth. When we are going to big events, making sure that we have face masks on as well. Because we have to remember that COVID is about preventing you passing it on to someone if you've got it, but also preventing yourself from catching it as well. So it's a two-way thing, and everyone in society, if we all focus on that and we do our responsibilities, that's how we curb the transmission.
I remember in 2020, after the lockdown was lifted, after the ban was lifted, and then somewhere in 2021, it looks like a number of Ghanaians started adopting a lifestyle that they claim was helping, helping to manage the situation. If you're not feeling too well, or if you see a few signs, symptoms here and there, you do this steaming thing. You take in a lot of sobolo. They started saying that sobolo with the local spices combined in there is really helping and all of that. Looking at how, now there's a resurgence, but you're not really seeing a number of people feeling, quite anxious and all of that about the situation. Do you think that at this point we feel like COVID came, we have overcome it? If it's coming again, what else?
So I do think that kind of thought is out there, and I think there's other people that are very concerned as well.
Okay.
And I think that at this point, you talked about some of the things that people were doing around that time. And I first of all say that if you have got symptoms and it is important that you go and get checked out to be tested. But then also, generally, they assess you to see whether you're mild or moderate. And for those people, it's about staying at home. But then it's resting, it's fluids, whatever fluids, whether it's sobolo, etc. I'm not going to dictate on that, but have your fluids. But steam inhalation is very good.
Okay.
And it does help to clear the airways. And, back then as well, we talked about, the oxygen saturation probes that some people had, and to measure it, that if it's going low, then that gives an indication that you need more significant medical help. So it's being aware of that. But I think also that it is people, when there's something that is on high alert, sometimes people want to shut down. They don't want to talk about it because no one wants to think about the fear that we went through before.
And that's the regular mindset of Ghanaians.
Yes.
That's how we live.
Yes. But what I would urge people is that in the beginning, we didn't know enough. And that compounded the fear. So even, I was practicing medicine in London at the time. Okay. And I was doing a lot of work in terms of community education. But when I was there, we all had our fear because we knew how science works. So we know that we know what we know, and we can share what we know, but we also knew there was a lot we didn't know. And we were learning together. And learning together can be intimidating, and it can generate fear. So even when we were trying to reassure people, we were concerned because we didn't have enough information. I'm not saying we have all the information now, but we have a lot.
We do.
And so we know that when surveillance and keeping aware of things is so important. And we know that we're seeing a peak, so we know our surveillance is working, and so we should be reassured by that, definitely. Yeah.
With all this information and how abreast we are of things, how we believe that we can deal with COVID-19, although it's, of its resurgence at the moment, is there anything at all that we should fear in relation to COVID-19?
I say not fear, respect. Respect the virus. Recognize that it's, like the same way that we respect colds and things, with the rainy season, we're all there sniffling and things, and we're, some people say, right, I'm going to stay indoors. So we know that there are viruses circulating. And so if we have that respect, don't fear it, but respect that it could affect us. So what can we do to contain things? And I always say to people, again, not for fear mongering, but we know the numbers that we're increasingly seeing in clinics and hospitals and in campuses, etc. But think about those people that are not going to get tested.
That's true.
That they have symptoms, they're at home, or they've got symptoms and they're in denial and they're not getting tested. So we don't have a full understanding of the level of virus circulating. And I know this afternoon, which is great, you know, the government is going to be sharing the numbers that they have and giving more public advice. But I say that it's not about fear, it's about recognizing that there is a virus that is still with us. We know how we can limit it. So we know in terms of face masks, we know in terms of back to basics, hand washing, you know, sanitation, using our hand sanitizers, being mindful where we are, thinking about well-ventilated areas. All of those can make a significant difference. The issue of, you know, vaccines is another conversation that we need to have.
I was actually going to go there. And, you know, I wish we had some more time so we can get into the issue of vaccines.
Yes.
But unfortunately, we do not because we have to zoom into another very interesting conversation. But Doc, before you go away, what would you want to tell the viewers in relation to COVID-19?
I would say that it's always been here, but we recognize that we are seeing more cases. Again, not fear, respect the virus. Be aware and take the precautions that are advised.
Like she said early on, we are going back to basics where you have to constantly be washing your hands. You have to make sure that you've got hand sanitizers in your hand. Like, please, use hand sanitizers. But you know, one of the things that I also learned some weeks ago, right here during Good Living segments, is sometimes the hand sanitizer, we see 99.9% alcohol in there. And then she asked, the doctor who was seated here asked, okay, so what of the 0.01%?
Yes. No, and it's so true. And the best thing is
wash your
hands.
Just wash your hands. Just wash your hands. It's that simple. Dr. Vanessa, thank you so much.
No, thank you for having me. It's been great to speak to you.
Same here. So I have been speaking with Dr. Vanessa Apea. She is the CEO of the Accra London Health Centre and have a trained clinician and advocate for health equity.